Next, our last action item for today's board meeting is to consider adopting policy 317, COVID-19 vaccination mandate for healthcare workers. We did have a presentation on this at our work session this morning, but I asked staff to come back in and deliver the presentation again, because I know that there are community members and staff members who are interested in this information, and we want to make it thoroughly available. So at this juncture, I'll turn it over to you, Mr. Carr and team.
Thank you, Chair Harrington. And with me today, although I think we're working a little bit on promoting, are Marni Kuyl and Eva LaBonte. Ms. Kuyl will be presenting on the current COVID-19 status, and Ms. LaBonte will be presenting on HR issues. I will be talking a little bit about the law and giving you an overview. We're here this afternoon for the board to consider potential approval of policy 317, which is intended to implement OHA's mandate for vaccination of healthcare workers. This mandate applies to all healthcare workers throughout the state. The state policy requires every employer to have proof on or before October 18th of steps taken to implement the state policy. The policy 317 that we're asking you to adopt would be the county's implementation of the state order. Next slide, please. Ms. Kuyl, are you there?
I am. Thank you, Mr. Carr and board. I just wanted to provide some background and context as you have this discussion and consider approval of the healthcare vaccine mandate policy. Wanted to let you know that our current case rate as of Friday was 184.5 per 100,000. This case rate puts us twice the level of the high transmission rate as defined by the CDC. So the CDC, anything over 100 per 100,000 is considered high transmission rate. In addition, our test positivity rate is 8.1, which is increasing and has been increasing for several weeks. So just wanted to give you that context, let you know this is the highest case rate that we've had since January of this year. So next slide. The other concern that we've had over time in this pandemic is our hospital capacity. And what this chart shows is the steep rise in hospitalizations and intensive care unit hospitalization since the middle of July. In Washington County, we continue to have high hospitalization numbers with 130 patients admitted as of September 2nd, and 30 of those patients being in intensive care. As you know, Governor has ordered, and we have had National Guard personnel assigned to hospitals in our area to assist with this huge increase in hospitalization and need. And the other thing that's important to understand is that because we are the medical hub in this region, some of the hospitalization numbers are impacted by transfers from patients outside of the metro area from other counties within Oregon. Next slide. So public health recommendations. I thought it's important also, as you consider your options and think about the best way to protect and save lives, to know what our recommendations are. And so number one is vaccination is our most effective tool. It saves lives and it reduces hospitalizations. It's safe, it's effective, and it's free. I wanted to clear up a little bit of confusion that may have come about earlier today. So the Pfizer vaccine, as you know, was approved by FDA for people 16 and older. The FDA approved Pfizer vaccine is the exact makeup of the previously emergency use authorization vaccine. There is no difference in vials. The difference is if they're receiving Pfizer vaccine and you're over the age of 16, your consent form says you're receiving an FDA approved vaccine. If you're under 16 and you're receiving Pfizer, you between 12 and 15, it's still under emergency use operation. And so you're receiving a different consent form. And the same applies to Moderna for all of their vaccine. But there is zero difference between the actual vaccine. There's no difference in manufacturing or any component within the vaccine. So I just wanted to make sure that that was really clear. The second important public health recommendation is that we continue to recommend that people, whether or not they're vaccinated, wear masks both indoors and outdoors, especially if you can't maintain the next recommendation, which is the physical distancing. And we also are recommending that people really consider limiting social gatherings and attending large events. And with that, I'm happy to answer questions or turn it right over to Eva to talk about the proposed Washington County policy.
Board members, any questions? No, we'll move it over to you, Ms. LaBonte. Thank you, Ms. Kuyl.
Thank you, Chair Harrington, commissioners. I'm going to first, before we talk about the specific policy, give you some updates on our current county employees. So as of the end of the day on Friday, September 3rd, we had 9 employees that we are aware of that are COVID positive and are in isolation currently. We also have 14 employees who are qualify as close contacts, and they are outside of work in quarantine for 14 days. To be in quarantine when you are a close contact means that you were unvaccinated, because we also have 10 employees who would have qualified as close contacts, but when you're fully vaccinated, you have the ability, as long as you're asymptomatic, to continue your normal daily activities, including work. And I wanted to also point out that the county has reinstated our temporary COVID leave policy. So all employees, whether they're vaccinated or unvaccinated, have the ability to use the COVID absence code instead of their own accruals if they need to be off work for either being in quarantine or being off due to being COVID positive. We also have in our policy an even more robust system to be able to telecommute, even if that's not something that normally occurs in that person's position. It includes a whole lot of ways that they can continue to learn and grow in their professional development while at home if they're not actively ill. Are there any questions on any of that?
Nope.
All right, if not, I'll turn it back over to Mr. Carr.
Next slide, please. So what I've displayed here up on the screen is Oregon Revised Statute 433.416. This is the state law relating to vaccinations, and it requires that any employer who has employees that are exposed to infectious disease provide vaccinations free of cost to the employee. The important section is the subsection 3, which prohibits mandatory vaccination. But you'll see that there's an exception unless such immunization is otherwise required by federal or state law, rule, or regulation. The policy that the board is considering today implements a state rule. Therefore, this law does not affect it. There's an open question about people not covered by the policy, but not covered by the state order, but the policy itself is not affected by 433.416. Next slide, please. The state mandate 333.019.1010 requires that all healthcare workers be fully vaccinated on or before October 18th, 2021. Fully vaccinated means that you've 14 days have expired since you received your final dose of vaccine. There are medical and religious exemptions. Their state has provided forms for those which the county will collect. The medical exemption requires a healthcare provider to sign on behalf of the employee, stating that the employee has a medical condition precluding them from getting the vaccine. As Ms. Kuyl has said, there are very few medical conditions that are contraindicated for the vaccine. The religious exemption just has to be signed by the employee, stating that they have a religious belief that precludes them from getting the vaccine. Under the policy, these forms will be stored in the employee's personnel file. Under the state order, we would have to make them available to the state if the state chooses to audit them. The state has said that they have no plans to do that in a recent FAQ. As I said earlier, the state order requires employers to prove that they have adopted a policy to implement this and are in compliance. To be in compliance with the state order, the board needs to adopt this policy. To give employees time to comply, it would be very helpful if the board adopted it today. Next slide, please. So this is the timeline for the Oregon Health Authority's implementation of this policy requiring mandating vaccines for healthcare workers. The first executive order was issued on August 5th. On August 12th, there was another executive order revising the executive order to remove an option for COVID-19 testing. The testing option would have allowed people to continue working if they provided evidence of frequent COVID-19 tests. That was withdrawn. So the only way to comply now with the order is by getting vaccinated. On August 30th, the OHA issued their first frequently asked questions to help us interpret the order. And there was another one issued Friday, September 3rd. Next slide, please. I wanted to highlight two of the answers to the FAQs because we've had a lot of concern among certain employees about these areas. The first one relates to the jail. There was a question about whether or not prisons or jails are included in the rule. Well, the state says yes, that they are. So the first sentence refers to state facilities. State facilities are actually exempted, correctional facilities, but they're covered under the governor's order requiring that all executive branch employees be vaccinated. So anyone who's working in a state correctional facility will still have to be vaccinated, but it'll be just under a different order. What this FAQ says is that county and local jails are subject to the order, but it only really applies to the healthcare setting within the jail, not to everyone in the jail. Next slide, please. Another area of some ambiguity is whether patrol deputies would be subject to the order. As you all know, patrol deputies frequently are called upon to provide some level of medical assistance, whether it's first aid or administering Narcan or just transporting someone to a health facility. This FAQ, which came out late Friday, says that they're not covered because, and I quote, "It is likely not a fundamental part of their job to provide direct or indirect medical care in a healthcare setting." So it seems like the state is setting up a test for the healthcare worker exemption to a requirement to apply that the person provides direct or indirect medical care in a healthcare setting, which would exempt out most patrol deputies. Next slide, please. So this is the definition of healthcare workers. As you can see, it is very broad, despite having, so we had some confusion when we first received this in early August about who was covered. And we really appreciate OHA's efforts to provide FAQs to us to help us interpret this more clearly. As you can see, you could read this to apply to a deputy in the jail because they are security in a place that provides healthcare. But the state has made clear, at least as clear as we can tell, that they're not covered. Next slide, please. And this is the definition of healthcare setting, which is also fairly broad, any place where healthcare, including physical or behavioral healthcare, is delivered. Next slide, please.
All right.
Yeah.
Yeah, so where the county is right now, we have determined that we have 313 employees who fit under the definition of healthcare worker by the state mandate. We have 230 of those in our Health and Human Services Department. Those people who, of course, provide physical, behavioral health care and are board certified or work in a school. We also have 83 employees under juvenile services who qualify. Part of it is related to Harkins House, which is our juvenile shelter, and they received a letter from the state indicating that because they have behavioral rehabilitation services funding, that they all are automatically included. The other counselors, juvenile counselors and supervisors, interact with those youth in custody in Harkins House. They also go to schools quite often. And under the school's mandate, anybody who interacts or comes into the school to even volunteer is required under the school mandate to be vaccinated. So the combination of both of these mandates leads us to the point where the juvenile services employees, 83 of them, do qualify under the mandate. So that ends up being about 14% of our current staff fall under the current definition as we have it in the policy before you as a healthcare worker. Next slide. So the policy that we have, what does it mean and how do we enact it? So we have the requirement for healthcare workers by or before October 18th to submit documentation to the county. And that will be done through our secure portal, through our human resources information system, through employee self-service. And they need to submit either documentation of their full vaccination or a religious or medical exemption form. And all of the documentation will be reviewed and then verified, and we'll communicate back to the employees to let them know that those were received and verified. We are asking in this policy for the board to extend the definition of medical layoff. And we're asking that so employees who do not meet the standard of either being fully vaccinated or having an accepted exemption would be separated from the county under medical layoff. And the reason we're asking for that exception or that extension of medical layoff is so employees in that situation would have the option for up to a year to be on a recall list. And if a position becomes open in the exact classification they held when they left, and they can show that they are either fully vaccinated or have an accepted exemption on file, then they can return to their work at the county. We also have in our procedures to implement this policy, recognizing that this is a short timeline for employees to become fully vaccinated, the opportunity for employees who can submit documentation by October 15th, showing that they are in process of getting their full vaccination, a temporary exemption. So they would have the ability, if they've had one dose of a 2-dose vaccine, to continue employment and stay out of work using one form of their accruals, vacation, for example, and not sick leave, but using other accruals that they have available. If by October 15th, they have received either the single dose of the single-dose vaccine or 2 doses of the 2-dose vaccine, and they are simply waiting their 14-day point to become fully vaccinated, that they could continue working as long as they're wearing a medical grade mask to keep everyone safe. So we're adding that in as we implement this policy. What questions do you have?
Eva, I have a question.
Sure.
Is it okay if I ask this question, Chair? I think you're muted. Oh, okay. Jinx. The medical layoff part, I think I asked this earlier, but I didn't have the slide here. And I think I did ask, but I got an answer and I'm not sure if I fully comprehended what it was said. Why aren't we going the route of, requiring people who do not meet, who are not in people who are staff who will be non-compliance with this policy? Why aren't we going the route of requiring them testing?
Yeah, I appreciate the question. So the testing option is something that's become what we've seen from providers of the test, that it's an administratively incredibly difficult to do because there's only a certain amount of tests available. And for a number of employers to end up asking people to do mandatory testing would be a burden on the system for testing. And I think Ms. Kuyl has some more information on that.
Well, and maybe it's Mr. Carr, but I also believe we would not be in compliance with the executive order because that option was removed by the governor.
Yep,
But
that's correct.
And it's not included in the OHA rules as an option. So it's be vaccinated or have an exemption or not employed in health care in any setting.
Mhm. Yes, that's correct.
Thank you.
Are there any other board questions at this time? Okay, next slide. So here we are. The action for today is asking the board to adopt this policy 317 so that we are in compliance with the state requirements by adopting a healthcare worker vaccination policy program. Earlier in our day today, we had some discussion about might we consider wider exemption here at the county. Board members, various board members expressed wanting additional information of a whole variety before we consider such a proposal. So we're now here before us with policy 317. And so now is the time for commissioner comments and or a motion and a second to adopt this policy. I'll turn it over to you, colleagues. Everybody's on mute.
I'm not. I'd be happy to comment. I'm not going to say a lot because we talked about this for about an hour and a half this morning. I will be voting no. And it's not because I don't believe in vaccinations. I think we all should have them. I think it's incumbent upon us to try to make certain that people are vaccinated very quickly. But as I said this morning, it's problematic when a state agency doesn't give us really time to find positions, if you will, for people who are going to be dismissed on October 18th, and there certainly will be some who are continuing to refuse to do vaccinations. And what I've asked for is that we have time, and I've heard that we don't have any time, and I'm willing to make the statement just personally. I think that's unfortunate. We have valued people who've been with us a long time are going to be summarily dismissed, and I just think we need to do better for our employees than that. And so I will indeed be voting no in regard to a broader application. I have the same issues, and if the board wants to discuss that, again, come up with a business plan on how we're going to address these folks, which, by the way, for those who might be listening, could be as many as 700 of them are employees who may not be with the county. I think we need to put a little extra effort in there. So I'm a compliant guy, as I mentioned. I believe if the governor says something, we need to comply. But if it's an unreasonable time period, I don't think that's fair. So that's my position.
Thank you, Commissioner Rogers. Any other comments, commissioners? Seeing none, is there a motion to adopt policy 317?
Excuse me, Chair, I'm sorry, I was late to get my unmute. I just wanted to say that I will be voting yes on this, and I am interested in the in looking at what it might mean to expand. I think it's our responsibility to protect those who can't protect themselves, and I'm referring to those that are under the age of 12. And also those who, for some reason, may not be able to get the vaccine. I also want to make the same statement I made in work session this morning. We ask our healthcare workers to be vaccinated on a variety of number of vaccines already. I think it's important that we recognize that. I also think it's important to recognize that we expect our school-age children to be vaccinated and take that responsibility as children, and I believe it's our responsibility as adults to protect them. So those are my comments.
Thank you, Commissioner Treese. Commissioner Fye, did you want to make any comments? See,
No comment. I can make the motion.
okay, thank you. Do we have a second on that motion? Okay, thank you, Commissioner Treese. I will add my comments that we've all been through a lot these 18 months of this COVID, new coronavirus, global pandemic. I think it's really important for us to protect our kids as well as those who cannot get vaccinated. I've had the benefit of learning from recent Kaiser Family Foundation studies, including a survey of unvaccinated workers showing that 4 in 10 of those unvaccinated workers said they would get the shots if required. So I remain hopeful. It was also noted that from a public health perspective, a lot of efforts have gone into persuasion, but those efforts have reached their maximum. So my hat's off to all of our county, regional, state, and federal public health programs and messaging to get the best available information out to people. I really appreciate all that has been done. And I look forward to voting yes on this proposal as well. And I look forward to our learning more from our employee base for possible further consideration. And with that, all those in favor of voting for this policy 317, please vote by raising your hand or saying aye. Thank you, commissioners. Any opposed? Thank you, Commissioner. The motion passes 4-1.